Avoid room 314 if you can. That was the entire handover report I got from the day shift. No clinical update, no vitals trend, just a warning. He's manipulative, demanding, a classic difficult patient. In the ward, a label like that is a contagion. It spreads from nurse to nurse before we even step into the room. It changes how we walk, how we breathe, and how we listen. But what if the label is a lie? What if the behavior everyone is fighting is actually a scream for help? At 10 p.m., the call bell rings, he wants his pillow adjusted. 10:15 p.m., the call bell rings, his water is too cold. 10:40 p.m., the call bell rings again. This time he's angry. He's pushing the button every 3 seconds. By midnight, the entire floor is frustrated. When a patient is labeled difficult, our instinct is to protect ourselves. We stay out of the room. We do the bare minimum. We pass the ice pitcher, modify the bed, and leave as fast as humanly possible. We see the anger, but we miss the anatomy of it. At 3:00 a.m., I walked into room 314, bracing for a confrontation. The patient, Mr. Davis, was sitting straight up in bed. His face was flushed. He threw his plastic cup across the room.
Nobody is listening to me.
He yelled.
You are all incompetent.
My hands tightened around my clipboard. Every instinct told me to set a boundary, defend my staff, and walk out. But then I forced myself to stop. I stripped away the handover report. I erased the word difficult from my mind. And I actually looked at him. Really looked. His chest was rising and falling too fast. Not from anger, from effort. His fingers weren't aggressively gripping the bed rails. They were white-knuckled because he was anchoring his body to breathe. I grabbed the pulse oximeter, 84%. Mr. Davis wasn't being manipulative. He was drowning in his own lungs. When the human brain experiences early hypoxia, a lack of oxygen, or the beginning of sepsis, it doesn't always trigger a textbook alarm. It triggers panic. Fighting, lashing out, and constant calling are often the psychological manifestations of an impending clinical crash. He was calling the desk every 15 minutes because he instinctively knew that the moment he was left alone, he was going to stop breathing. We fixed his oxygen. We averted a code blue, but we almost missed it entirely. Handover bias is the most dangerous unwritten phenomenon in medicine. The moment we label a patient's personality, we stop assessing their physiology. Next time you are warned about a difficult patient, remember Mr. Davis. Don't brace for a fight. Look for the fear. Look for the unseen. If you want to see the ward for what it truly is, hit subscribe. Let's learn the things textbooks leave out. Take care of your patients and take care of each other.